In our weekly Ask the Doctor segment, today we're talking about a fatty liver. You're saying, well, what's that? Well, for more on this, let's go ahead and talk with nurse practitioner. We're talking to Jessie Correa. She is with the UAB West Gastroenterology. Say that for me.
Gastroenterology.
Yeah, I need all the help I can get. So what is it when it comes to a fatty liver? What is it?
So a fatty liver, actually, everybody's got a little bit of fat, but
Okay.
for you to be considered as having a fatty liver, it's affecting more than 5% of your liver tissue. And it's actually super prevalent. It's about 25 to 30% in the general population.
Okay, so it's fairly common then.
Yes.
Okay.
Definitely.
Does it vary in impact or issue or what?
Definitely. So the two biggest things is that fatty liver can, obviously you have fat on the liver, but it can also cause inflammation and fibrosis, so hardening of the liver tissue, which can eventually lead to a cirrhosis. Those are all possible consequences.
Yeah, so when it comes to this though, can we improve the fatty liver?
Definitely, definitely. So there are multiple risk factors, right? Obesity, high blood pressure, high cholesterol, diabetes, moderate alcohol use, genetics, all of these can affect it, but definitely have solutions. So we always recommend for our patients to follow the Mediterranean diet. Really simple, you can pop it up on Google, but it's mostly fish, legumes, healthy carbs, not so much processed things and artificial sweeteners like in soda and sweet tea, which unfortunately everybody loves. Also, exercise is a big one. And in addition, you can take vitamin E if you don't have diabetes or cirrhosis. That's been shown in studies to help. So there are definitely a lot of things you can do to help.
Yeah, well, you mentioned the consequences, things that we can help, but are there, outside of obesity, are there other things that show that you might have this issue? Oh,
definitely. So you can be diagnosed multiple ways, right?
Okay.
You could go to your primary, have lab work, which would check your liver function, and the fat can definitely affect those numbers. We would also check you with ultrasound or blood test or another test called elastography. That would let us know what the tissue actually looks like. So the labs for the function of the liver and the other stuff for the tissue.
Yeah, and if somebody comes into the office, you get diagnosed with this, what type of treatment would you?
So besides the obvious, which would be weight loss, and greater than 10% has been shown to reduce fibrosis. So that stiffening of the tissue, if we lose more than 10% of the weight, it helps. But there's actually medication nowadays. There's a drug called Resdifra. You have to qualify for it depending what level of fibrosis. And like I said, healthy diet, healthy lifestyle.
Okay. So we all, and I'm going off script here for you, so this is your opinion.
Yeah.
I'm overweight,
yeah.
I admit it, you know, I could probably lose 20 pounds. Does that mean that I have this issue?
Not necessarily. Everybody varies, and we really don't know what pushes some people to a liver cirrhosis and what doesn't.
Okay.
So sometimes patients will ask me, and I'm like, all we know is what you have now, and we want to prevent it from getting worse. But definitely, like I said, the way to find out would be to see your primary to start things off, and if they find anything abnormal, they would send you to us.
Whew. Maybe there's hope for me yet.
Yes, you're in great hands. You always can come to me.
There you go. We're nurse practitioner Jessie Correa. Thank you so much for helping us out.
Thank you so much for having me.
Okay, and we've got plenty more coming your way. Do not go anywhere because we got more information like she just gave right after the break.